Hi, I'm Dr. Ahmad Shukri, Damansara. I am one of the resident consultant physicians that specialize in gastroenterology and hepatology. Colorectal cancer is one of the cancers that happen along the colon and rectum. And the cancer cells develop from the cell which is a problem in the DNA or genetic cells, where it divides fast enough out of control and develop into cancer cells. And colorectal is the site where the cells start develop, which is the colon and the rectal. We put it together as colorectal. The cancer of colorectal in Malaysia, like other part of the world, is increasing in trend. It's reported to be first of the highest colorectal cancer among men and second among women after breast cancer. So the numbers are very alarming. Colorectal cancer can develop without any reasons. For example, this under categorized by sporadic, without family history, without genetic, but someone could develop colorectal cancer. Those above 50 years or age, a higher risk to develop colorectal cancer. But on the other part of it, colorectal cancer also can be inherited. How we differentiate these two? If someone has colorectal cancer among family members, their parents, their siblings, so more likely that other siblings might have a risk of having cancer. So the cancer might develop in this group of patients even earlier than 50 years old. Compared to those sporadic cases, it can develop anytime to any person, but normally happen at the age of above 50 years old. The symptoms of colorectal cancer is started with the very mild symptoms and to very prominent symptoms. Patient may develop and complain of altered in bowel habit. If someone who having bowel opening once a day, for example, and then suddenly notice a change in bowel opening becomes 2 or 3 times a day. So from normal become loose or diarrhea. Or on the other hand, from normal become constipation, means patient open the bowels once every few days, and this for few weeks, So that's part of the symptom. The other symptoms, when someone notices blood in the stool. And the other symptoms that patient might have recurrent abdominal pain or bloatedness in the stomach, recurrent, and without reasons. And the other extent, patient may complain of loss of appetite, loss of weight. They're quite late symptoms by having loss of weight at that time. So this is among other symptoms of bowel cancer. Majority of the cases, they don't come with the symptoms because they grow inside the colon, where the colon is quite spacious. So it takes some time before the symptoms develop. So this is the worrying about for us, where by the time patient comes with the symptoms, we might pick up stage 2, stage 3, or stage 4. Based on the studies in Malaysia, majority of the cases who come to us, when they come with the symptoms, they're already stage 3 or stage 4, about 50-60% of them. So we are looking how to encourage public to come early to detect cancer at the beginning of this process of cancer, so that we can prevent become a full-blown cancer. It is curable depending when the patient comes to see us. Okay? Because the colorectal cancer started from small polyps, very small, tiny polyps, which is adenomatous polyp in the colon. And it grew over the years before becoming to cancer. So if we can do screening of colorectal cancer, there are few methods of doing the screening. One is doing the fecal occult blood test, or colorectal screening by colonoscopy. Then, by doing colonoscopy, we can see polyp, even small polyp, 5mm polyp. Then we can remove the polyp. Once we remove the polyp, that prevents development into cancer. Right, this is interesting. KPJ Damansara Hospital have a very special technology in terms of the colonoscopy. The conventional colonoscopy that most of the hospitals in Malaysia are having is the conventional forwarding view, in which the view of the colon is 170 degrees. When we do colonoscopy, we will view the colon on withdrawal of the scope. At that time, the view is about 170 degrees. So there's a chance of missing polyps. So by having a new system, we call it FUSE system, full spectrum endoscopy, the view covers 330 degrees. So for example, you're reversing your car, you might miss a blind spot. That's why you need extra mirror right and left. So the new system have three images. One, the forwarding view, like conventional, and additional side and left views. So the coverage 330. So the chances of missing polyp very, very minimal. This is very important because once we label the patient normal colonoscopy, patient will not come back to see us for another colonoscopy until patient develops symptoms. That's too late. So by having the full spectral endoscopy, we can ensure once we see it's normal, it's really normal findings in which the chances of missing polyps very, very minimum compared to conventional scope the other hospital are having.